There are different types of endoscopies doctors perform. In this video, I will be talking about upper GI endoscopy, also known as Oesophago-Gastro-Duodenoscopy, and I'll be focusing mainly on the indications for this test and how to prepare for this test. If you would like to know more about other types of endoscopy like colonoscopy and flexible sigmoidoscopy, you can watch the video in the link given. An upper GI endoscopy is a procedure used to look inside the organs of the upper part of your digestive tract. It looks at the esophagus, stomach, and the duodenum, and is therefore known as an Oesophago-Gastro-Duodenoscopy. It uses a long, flexible tube with a camera at its tip to look inside your organs. Doctors use this to both diagnose and treat diseases. During this procedure, doctors may also take pieces, known as biopsies, to be further tested in a laboratory. An upper GI endoscopy may be done for a number of reasons. If you have abdominal pain, nausea, vomiting, heartburn, or a difficulty in swallowing, the doctor may do this test to identify the cause of your symptoms. This is particularly important if the doctor has any suspicion that your symptoms may be due to cancer. If you have vomited blood, the doctor may do an endoscopy to identify the source of bleeding and why it has developed. There are many interventions doctors can do during an Oesophago-Gastro-Duodenoscopy. If there are abnormal growths, known as polyps, they can remove them. And if there is bleeding, they can inject medicine to stop this bleeding. Doctors can use an endoscope to remove objects that have been accidentally swallowed. If there is an abnormal block in an organ, they can insert special tubes known as stents to relieve this obstruction. Doctors can use special endoscopes with an ultrasound probe at the tip to better visualize organs inside your body. This is known as endoscopic ultrasound. An upper GI endoscopy is usually done as an outpatient procedure. This means you can come to the hospital on the day of the procedure, have the test done, and go back the same day. Most will undergo this test without any sedation. If you do need sedation, you need to come with someone that can take you home after the endoscopy. You will need to stop eating for at least 6 hours before the procedure. You can have water until 2 hours before your endoscopy. There are several reasons for this. If your stomach is not empty, that will interfere with the doctor's ability to identify any abnormalities. If you vomit, this content may enter your lungs. You need to tell your doctor all the medicine you take. If you're on medicine, like blood thinners, these may need to be stopped several days before the procedure. This, however, has to be balanced with the risks of stopping your medicine and the reasons you're on it. The doctor will also advise you on what to do with your other medicine. In the second part of the video, I will describe how the procedure is done and discuss the potential complications. If you would like to know more about this or have any questions, please leave a comment below. You could also comment on any topics you would like me to cover in the future. Thank you.